Hello, you are most welcome, ladies and gentlemen, to Tuesday Night Anatomy with Daniel Okwan. Today's section, I want to look at an aspect of the power behind the voice. And today, I want to explain why females, yes, are more prone to developing UTIs, that is urinary tract infections, compared to that of the male. Yes, of course, this is not, something that is new because in the society, everyone is aware. Now, to buttress this, findings from the literature reveal that females are about 30 times more prone to urinary tract infections compared to that of the male. And one thing is that today it is my job to explain the anatomical relationship that leads to that kind of phenomenon that we are observing. So one thing is that yes, we have upper urinary tract infection, yes, lower urinary tract infection, mainly where we talk about, for instance, cystitis, where of course there's that kind of inflammation of the urinary bladder. And when that happens, then there's that kind of urgency, there's that kind of urge to empty the urinary bladder quite frequently. And it's also accompanied with some kind of painful micturition. As one urinate, there will be some kind of pain associated with it. Yes, not only that, we may also have that kind of urethritis, where there's that kind of burning sensation in the urethra, among others, such that when one even urinates, there's that kind of foul smell in that kind of urine, of course passing bloody urine or blood stained urine. Not only that, where there will be that kind of abdominal pain, among others. Sometimes if it affects, for instance, it goes on and it affects the kidney, then that kind of pyelonephritis is observed. But that is real extreme cases, where of course there's that kind of extensive urinary tract infection that has affected the upper urinary portion. So that is one thing that we find. Now, usually one thing that we know is that commonly the most common pathogen that is implicated in these kind of urinary tract infections is something we call E. coli. That is the Escherichia coli, and that E. coli usually is a normal flora that we find in the gut. So of course in your alimentary canal, in your digestive tract, we have this E. coli as a normal resident over there. However, it can also even cause that kind of, it can be pathogenic to, of course, this kind of even, gut as well. But one thing is that when it finds its way in the urinary tract, then it's going to cause some of these, urinary tract infections that we are talking about. So that is one thing. Now, even apart from the Escherichia coli, we have something we call Klebsiella, pneumoniae. We may have what we call Proteus mirabilis. It's one of the pathogens. We talk about, Enterococcus fecalis. We talk about what we call Pseudomonas aeruginosa. Among other ones that we look at. So all these pathogens can even implicate themselves in this kind of urinary tract infection, other than the E. coli, which is the commonest pathogen which will cause all these things. So that is the first thing I want you to know. Now, why is it that females are more prone to this UTI? That is what we want to review tonight, and the reason is simple. If you look at the male urethra, males are a bit safe, when you talk about some of these things. When you look at the male urethra, on average, it's about 18 to 20 centimeters long. Now, that of females is just around 3 to 4 centimeters long. So it tells you that the proximity, right from the external aspect, from the external urethral orifice, into, of course, for instance, the urinary bladder is quite, you travel shorter distance in females if the pathogen will have to travel from the external urethral, orifice into, of course, the urinary bladder to cause, for instance, cystitis, then to travel shorter distance compared to that of the male, which will have to travel quite a longer distance, to cause that kind of, infection. So that is, one basis that we look at. Now, again, if a female present with UTI, yes, I'm talking about the frequency, okay, generally there's that going to be that kind of frequency of urination, micturition, and the reason is simple. Now, females, one thing that we know is that females do not have internal urethral sphincter. Now, one thing which is a bit debatable, but I mean, if you look at it from the anatomical basis, it makes sense, because for males we are having that internal urethral sphincter to prevent retrograde of semen during ejaculation. We don't want that semen to go back into the urinary bladder. We need it to go forward, eventually into the vagina. Okay, so that is what we are looking at. Females are not going to ejaculate any semen or anything, okay, in there, and therefore there's no need for them to have internal urethral sphincter, which is thickening of what we call the lower muscle fibers in what we call the neck of the urinary bladder. Okay, that is the detrusor muscle. That is what we are talking about. Okay, so it means that females, you have that urgency to urinate most often, so that if you don't take care, then that urinary incontinence, you may experience it. You may urinate on your own self and what have you, if you don't take care, if you don't get up early, and of course go and urinate. Again, of course, we talk about the deep perineal pouch, and we know that one of the contents is something we call the external urethral sphincter. Now, this external urethral sphincter is very competent in males, okay, over there. But for females, even for females, yes, you are having it, but that one is less competent. So it means that kind of urgency, you have to quickly, look at all these things. So that is, one another aspect that I want you to be aware of. Now, again, if you look at the urinary, if you look at that kind of urethra in females, it's in the same vicinity as, of course, the vagina. So, for instance, if there's that kind of any, illegal sexual intercourse going on over there, and then let's say there's that kind of infection in, of course, the vagina, and then eventually it can easily get to the urethra, because it's just anterior to, of course, the vagina, and after all, they are all in the same vicinity over there, okay, in the perineum over there. Okay, that is one thing. Again, I told you that the commonest, okay, pathogen is the Escherichia coli, and this E. coli, yes, is in the gut. So it means that if you defecate, okay, you have some kind of these kind of traces of this kind of E. coli in there. So it means that proper, okay, application of what you call the tissue paper, okay, to wipe the place after defecating is important, okay, in preventing some of these UTIs. So that if you wipe forward, then what will happen is that it's likely that you are going to cause some kind of infection to not only the urethra, to also even the vagina. Okay, that is one thing that I want you to be aware of. Okay, so that is essentially what is the main anatomic reasons, okay, why females, okay, will be more prone to this kind of UTIs. Therefore, it makes sense that for one to ensure that you don't suffer from this kind of UTIs, then the important thing is the hygiene. Okay, hygiene, especially in the perineal region, is very important. Okay, proper wiping of the place, okay, keeping yourself neat by way of the proper underwear, okay, it has to be kept neat over there. Okay, so that is one important thing that I want you to know. Sometimes people insert a lot of things over there, and that is also another thing that we have to look at, okay, so that we ensure that this place, which frequently cleanses itself by way of course, for instance, the vagina, you don't need to be putting a lot of things over there, otherwise you may suffer from some of these UTIs. Yes, studies have also shown that sometimes the frequent use of what we call these kind of birth control pills and what have you, these contraceptive measures, may also lead females to be prone to some of these urinary tract infections. Yes, not only that, even at the time of menopause, where of course, for instance, estradiol is not produced maximally, the place may become so dry and what have you, and all these things are let's say predisposing factors to formation of UTI in females more than, of course, in males. So I hope you find this meeting helpful. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.